Hello, my name is Austin Edgar, and today I will be talking about Candida overgrowth and treating it with traditional Chinese medicine. Throughout this presentation, there will be a few hard words to pronounce. I tried looking them up to pronounce them correctly, but I'm going to try my best during this presentation, so bear with me. Thank you. So, what is Candida? Candida is a fungus that lives inside of a healthy human microbiome. Candida is found in the mouth, throat, esophagus, gastrointestinal tract, and vagina. When the body is under physical or mental stress, Candida become an opportunistic pathogen. Once in a pathogenic state, it will take the opportunity to grow out of control. This type of fungal infection is called candidiasis. At this stage, it suppresses the victim's immune system, which then can lead to diseases that can be life-threatening. Candida overgrowth can affect the organs, bones, or at its worst, it can infect the bloodstream. Some of the most common species of Candida are, and these are the words we talked about, Candida papilariasis, Candida glabrata, Candida auris, and the most common, Candida albicans. Some of the chronic Candida overgrowth symptoms are noticeable while some go undetected for quite some time. According to the CDC, symptoms manifest differently depending on which part of the body is most affected by overgrowth. Symptoms that show in the vagina are recurring yeast infections, vaginal itching, soreness, abnormal discharge, painful intercourse, and pain while urinating. Candidiasis in the mouth, throat, and esophagus is called thrush. Thrush has symptoms such as white patches on the tongue, roof of the mouth, cheeks, and throat. Symptoms of thrush also include red spots on the tongue, soreness of the throat, cotton mouth, and cracking in the corners of the mouth and a loss of taste. Candidiasis is most severe and is usually seen in patients in critical condition in hospital settings. Symptoms of this include fever and chills that don't improve after antibiotic treatment. If the infection continues to spread, Candida can run rampant in the heart, brain, eyes, bones, and joints. There can be a long list of things that contribute to Candida overgrowth. Those that are immune compromised run the highest risk of being taken over by Candida. Those who suffer from chronic illnesses such as diabetes, heart disease, and cancer run the risk of having Candida overgrowth. A factor that can be changed that is the highest contributor to overgrowth is diet. A diet high in refined sugars, refined carbohydrates, dairy products, processed foods, and alcohol is a recipe for overgrowth. These foods lower the consumer's immune function and provide an environment for yeast and bacteria to flourish. Alcohol is one of the more concerning things to consume because not only does it turn into sugar in the gut, but it also kills off any friendly bacteria that can keep Candida at bay. Sugary foods feed Candida, so if any overgrowth is present, eating these foods will exacerbate your problems. Mitchell Medical Group states that other lifestyle risks involved with Candida overgrowth include the following: antibiotic use, stress, oral contraceptive use, chemotherapy, steroids, radiation, and recreational drugs. These lifestyle actions can disturb the microbiome, which can cause an imbalance of gut flora. This has a direct effect on immune function, which we have discussed can provide an environment for Candida to overgrow. One of the highest contributing factors to Candida overgrowth is antibiotics. Antibiotics are being overprescribed across the country. Antibiotics can be a lifesaver in a pinch, but they wreak havoc on the gut microbiome. According to the study done by Jamie Ramirez and colleagues, antibiotics cause a decrease in bacteria diversity, can lead to an overgrowth of pathogens within the gut, can build antibiotic resistance, and lead to gastrointestinal issues as a side effect. Antibiotic-resistant bacteria is one of the biggest health threats to our world. The overuse of these antibiotics pose a huge risk to keeping harmful bacteria controlled when needed. Kang and his associates describe biofilms as highly organized communities of microorganisms, including bacteria, fungi, and a mixture of strains. They form a unique natural ecosystem that can attach to a living or non-living surfaces. Candida can form biofilms inside the gut, on the skin, and can attach to medical devices. These biofilms can become resistant to antibiotic treatment, proving to be a major problem in healing from Candida overgrowth. Drugs that are categorized as triazoles are antifungal and inhibit the growth of Candida fungi. When azoles are taken long-term, this can cause resistance to these powerful drugs, causing bacteria and fungi biofilms to thrive. Biofilms are something we will be discussing throughout this presentation, and they play a huge role in Candida overgrowth conditions. Traditional Chinese medicine is all about achieving balance. Chinese medicine recognizes illness as an imbalance of energy. To understand Chinese medicine, you must understand their theory of yin and yang. According to Kapchuk, in his book, The Web That Has No Weaver, yin and yang are two opposites that balance each other out. The Chinese believe that these energies relate to everything in the universe, and that one cannot exist without the other. They are always changing, controlling each other, and transforming each other. In different words, they can be recognized as positive versus negative, male versus female, and hot versus cold. In traditional Chinese medicine, to diagnose an individual, you take into account that every person is their own universe. This means that no person is the same, and every situation calls for a unique approach. A quote from Kapchuk on this matter is, "One person's yin symptoms may be yang in another person's symptoms." Chinese medicine doctors aim to recognize patterns within a patient to see what is out of balance. Patterns can be categorized into a few yin and yang symbols, such as the following: interior versus exterior, deficiency versus excess, cold versus heat, and lastly, damp versus dry. Qi is another important term within Chinese medicine. The Maryland University of Integrative Health describes Qi as the life force energy in the universe that is ever-changing. It is hard to place words to such a complex thing as Qi, but to my understanding, I think of it as life energy. It is everything, and everything is made from it. An imbalance of Qi is thought to cause illness. Some important terms are yin, which is the essence of being that is related to growth and reproduction. Shen is the spirit, which is related to emotions. Zhu is blood that feeds the mind and body the nutrients needed to survive. And lastly, Jin Yi is the bodily fluids that give moisture and protect the body. All of these categories of the body, mind, and soul can be at extremes, and such as an excess or deficient. Imbalances of these categories can bring on their unique troubles, and as humans are so complex, if one system is out of balance, they all are. To regain balance, you must align your organ systems and the elements, which are earth, fire, water, wood, and metal. Each element has its own long list of characteristics that can apply to disease, health, and personality. The Chinese medicine system is so complex, and this is only a small explanation of it. If you are interested in learning more, I highly recommend looking into the 5-phase theory and diving deeper into the concepts I have touched on. Traditional Chinese medicine has a few different types of treatments for bringing an unbalanced system back into harmony. Some of these treatments include acupuncture, moxibustion, cupping, massage, herbal medicines, and Tai Chi. The most commonly recognized methods of treatment are acupuncture and herbal remedies. In acupuncture, there are thought to be over 2,000 different points of the external and internal body that are linked with meridians. When these points are stimulated, it can move stagnant qi that could be blocking the energy needed to flow throughout your system and create a healthy environment. Herbal remedies are effective and usually safe. They are amazing to alternative Western pharmaceuticals. They can also aid in unblocking stagnant qi and work by activating your body's natural healing abilities. The first study that I want to discuss today is a case study on the risk factors associated with fluconazole resistance and Candida papillosis, candemia. Candida is a big threat to hospitals, especially within ICUs where patients are in critical condition. A non-albicans species called Candida papillosis has become more common in ICU settings and is a huge threat. The drug fluconazole is the major line of defense when treating this Candida strain. It is becoming increasingly more common that this strain of Candida is becoming resistant to fluconazole. This case study was performed in a 750-bed hospital located in Turkey between the years 2015 and 2021. The study focuses on patients that tested positive for this Candida strain. The objective of this study was to see what factors are connected to fluconazole resistance within these patients with candemia in the ICU settings. Out of the 177 patients that were studied, 43% were fluconazole resistant, 7.3% were fluconazole reduced susceptible, and 88% were fluconazole susceptible. Within the resistant group, conditions such as the following were common: the presence of cancer, immunosuppressive therapy, history of intra-abdominal surgery, hypoalbuminemia, and previous fluconazole use. This being said, the more immune compromised the patient is, the more vulnerable they are to Candida taking over the system with no help from the main drug used to keep this fungal infection in check. I chose this study because it demonstrates the resistance Candida is developing to the pharmaceuticals that are primarily used in Western medicine. To those who are immune compromised are at higher risk, but even those who have used the drug in the past can be at risk as well. This is dangerous for the future of patients with Candida because Western medicine does not know where to turn in treating those who become resistant. The second study I want to discuss today is antimicrobial and antibiofilm properties of olorapine and against fluconazole-resistant isolates of Candida albicans and Candida glabrata. To demonstrate that herbal remedies are effective against inhibiting Candida strains while also being cost-effective, I chose this study. It looks into the compound olorapine and its effects on Candida glabrata biofilms at a molecular level. This strain of Candida is found in the mouth and can be grown in conditions where dental plaque and poor dental hygiene is present. This strain of Candida is also found on stents, tubes, and catheters. Among other Candida strains, it is also a concern that this strain is becoming more resistant to pharmaceutical antifungals. Olorapine is a phthalofenic compound found in olive oil and olive leaves. This experiment was done on this Candida strain in vitro, and the results are not surprising. It showed clear anti-biofilm effects that break down existing biofilms as well as prevent them from occurring. This effect was dose and time dependent. This means that the higher the concentration and the longer period of time it was exposed to yeast, the more powerful it would act as an antifungal. Olorapine also shows to reduce gene expression related to biofilm formation. This study shows that herbal medicine is cost-effective and has little to no adverse side effects. There is a whole list of issues taking pharmaceuticals comes with. Herbal medicine also has many other benefits attached to it. According to this study's finding, olorapine is known for being antimicrobial, antioxidant, anti-cancer, anti-aging, and as a skin protectant. Herbal medicine can be a lifesaver for those who are antibiotic resistant and are immune compromised. The third study that I want to discuss today is about the isolation and identification of Candida glabrata from avian species and a study of antibacterial activities of Chinese medicine in vitro. Another strain of Candida that poses a huge threat to our society is Candida glabrata. It is classified as the second large pathogenic Candida strain after Candida albicans. When somebody is immune compromised, the strain of Candida can be found orally, on the skin, in the esophagus, and in the GI tract. This strain of Candida is a problem in poultry farms and jeopardizes the poultry's health and our well-being as consumers of this meat. The use of antibiotics in animal feed has been useful in fighting against these fungal infections. Due to the health and environment safety threat that these antibiotics pose to the world, they have been banned from being used in animal feed by many countries. Using antibiotics in our livestock's feed builds further on antibiotic resistance and pollutes the environment. There is a need for an alternative to these drugs, and in Chinese medicine might be the answer. The study tests a pigeon group that is recognized to be positive for high levels of Candida glabrata. They tested 7 different Chinese herbs against the strain of Candida in vitro to see its effectiveness in restraining growth. The 7 different herbs are as follows: Japanese sweet flag, shrubby sophora, water pepper, sickle pod, milkweed, dandelion, and hung bai. The list of herbs that had inhibitory effects on Candida from the most effective to the least is hung bai, shrubbery sophora, Japanese sweet flag, water pepper, sickle pod, and milkweed. Dandelion showed no effects on Candida. These herbs had an inhibitory effect on Candida but did not show that they were able to kill the fungus. These are Chinese herbs that are effective against pathogens like Candida, but Candida will not build resistance to them like pharmaceutical antifungal medications will. Feeding these herbs to livestock might be a wise decision to prevent disease. The fourth study I want to talk about is about antifungal activity of Cao Hong Ji Zhang formula against Candida auris and in vitro evaluation. There is yet another strain of Candida that is a threat to our health called Candida auris. According to the CDC, Candida auris rarely is found in the GI tract and primarily colonizes on the skin and surfaces. This makes it easy to spread in hospitals and on hospital equipment. This type of fungal infection spreads throughout the blood once the immune-compromised host is infected and then spreads through contact with surfaces and other patients. Like other strains of Candida we have touched on, this one has a high drug resistance rate as well. This study focused on Chinese herbal formula called Cao Hong Ji Zhang, CHGX for short. This herbal formula is comprised of 4 herbs. These herbs are the following: the root and rhizomes of Chinese licorice, the root and rhizomes of Chinese rhubarb, the bark of shore laurel, and the aerial part of patchouli. The CHGX formula results show that in vitro, these herbs inhibit the growth of Candida auris. The time and dose were an important factor. The higher the dose and the longer period this formula was up against Candida auris, the better the results of inhibiting growth. CHGX also reduced existing biofilms as well as prevented the growth of potential biofilms. I chose to present this experiment because it demonstrates the power of Chinese herbs against Candida. It shows again that Chinese medicine is a safe and affordable option against drug-resistant Candida strains. The final study that I want to talk about today talks on electroacupuncture and regulating intestinal flora and inhibiting inflammation in type 2 diabetes patients. Diabetes is a metabolic disorder that can predispose people to fungal infections. It has been shown that a person's gut flora plays an important role in the development of diabetes. Treating diabetes can prove to be a challenge, but researchers are focusing on a gut-targeted approach to a tricky illness like this. Acupuncture is a huge part of traditional Chinese medicine. It has been shown to balance out organs within the body as well as hormones. Electroacupuncture is a more modernized version of acupuncture that uses electric currents to stimulate ancient acupuncture points. This study tests electroacupuncture's ability to regulate diabetics' organs and gut flora to see if it is a good alternative therapy. This study was done on 3 groups of mice. The first was an electroacupuncture-treated diabetic group. The second was mice with type 2 diabetes that were left untreated. And the third was normal, healthy control group. The findings of this study showed that diabetic mice treated with electroacupuncture significantly reduced their fasting blood glucose levels, increasing beneficial bacteria in their gut microbiome, decreased their harmful bacteria, reduced inflammation, and showed major improvements in their overall gut health. This study showed that electroacupuncture or traditional acupuncture is a good method for reducing symptoms shown in chronic conditions like diabetes. This could show that acupuncture would be beneficial to somebody suffering from a Candida imbalance. If electroacupuncture shows that it improves the gut microbiome, that is exactly what a Candida patient would need to balance their gut. In conclusion, what stood out most to me about traditional Chinese medicine is that it is such a personal approach to achieving bodily balance. There is no one-size-fits-all approach there is no one-size-fits-all approach like Western medicine tries to promote. Chinese medicine is all about bringing your body back into balance. It is comforting knowing that no matter how out of balance you may be, physically, mentally, or spiritually, there is always a path towards achieving a state of peace. Chinese medicine is gentle on the body and uses non-invasive techniques for healing. It is a very spiritual practice that recognizes the impact on the soul and physical body. In healing Candida overgrowth, I see Chinese medicine as a great alternative to Western medicine. Western medicine can only go so far with fungal infections when they are resistant to pharmaceuticals that are prescribed. A patient with antibiotic-resistant fungal infection can be left hopeless in a Western world. Traditional Chinese medicine is an ancient approach that leaves much hope for a brighter future. Thank you for listening.